All right. Well, why don't we get started? I'd like to welcome all of you to the Graduate Prospective Student Discovery Series. Boy, that's a long title. The virtual event for the HPHE MPH program here at the Department of Health Behavior and Health Education at the University of Michigan. I am Professor Brian Zickman Fisher. I am the admissions chair for the MPH program, and I will be here with you today. And joining us also are several key staff people, as well as a current student who will be monitoring the chat and answering questions, et cetera. Let me just give you a little bit of an overview of where we're going. Yes, so first the introductions. As I said before, I'm Brian Zickman Fisher. We have Kieran Zakaris. Kieran is the director of the Office of Foundational Learning and Practice, and Jackie Cormany, who is our admissions coordinator, graduate program coordinator, source of all knowledge on student things, and the person you will be most likely asking questions to and who will be directing you anywhere you need to be going. We also have with us today Cheyenne Laldi, who is a current MPH student who can chime in on the chat whenever, if you have a question that you want to pose her, or if there's resources that we can direct you to. She's going to be trying to put stuff in the chat on a regular basis and to meet needs while our program is going on. So the basic outline of today is this. We're going to spend about the first 50 minutes or so doing an overview of the department, sort of what is HBHE, what is our identity, talk about the training and skills that you would receive if you come here as a Master's of Public Health student, and talk about the types of research that we do and the types of programs that we run. We'll also talk a little bit about what HBHE students become, some of the types of positions that our alumni get into, and then leave a generous amount of time open for questions on any and all of those kinds of topics. However, we're going to try and wrap that up by about 7:55 Eastern time, or 5 minutes before the hour, depending upon what time zone you're in, because at that point we will be joined by about 8 faculty who are going to then be hosting Meet the Faculty breakout rooms for the last half hour of our session. So you'll get to pick which topic you might be interested in, pop into a breakout room, and get to hear what they're working on, share your interests, etc. So that's our plan for tonight. And again, if anything comes up, please do put something into the chat and we can try and respond to it as we're going on. But I want to start today with a recorded message from our chair, Dr. Cleo Caldwell.
Hello. I'm delighted to welcome you to the Department of Health Behavior and Health Education. I am Dr. Cleo Caldwell, the chair of the department. We are glad that you are exploring our program because we have a lot to offer in terms of training in the field of public health. We represent the social and behavioral sciences in the field of public health. Our faculty, students, and staff are committed to improving population health with a particular emphasis on reducing health disparities and achieving health equity and social justice. I'm sure you'll learn a lot about our department during your time with us. We hope you will select Michigan's HBHE program to continue your education. Please feel free to ask any questions you have now or in the future. Again, welcome and enjoy your time with us.
So sort of capturing what Cleo's talked about, what is HBHE? We really are a department that is focused on the social determinants of health, thinking about all of the aspects that contribute to the health that people experience: the neighborhood, the social context, the economic perspectives, the healthcare system and how people interact with it, et cetera. That multidisciplinary and multi-perspective approach, that ecological approach, is really woven into both the department's curriculum and the department's research interests. If you come here, and we hope that you do, at HBHE, what you're going to do is you're going to receive training in that concept, right? The individual level, the community levels, and the structural level determinants of health. Our curriculum focuses on questions like how do you develop and then evaluate health intervention programs that are grounded in behavior change theory and implementation science. I'm a health communication researcher, and I'll talk a little bit more about that later, but you'll also get training in best practices for communicating and motivating people about health, as well as a lot of focus on partnership. How do you work with communities to create enduring solutions that meet the public health challenges that they face? And obviously that's going to be different for different communities. And we really do in our department think a lot about that approach as a partnership, not as we're going to zoom in and dictate the solution, but how do you work with and partner with communities, including through community-based participatory research projects. If we look at the sort of key competencies that our program focuses on, understanding the key determinants of health and health disparities, particularly from a social perspective, applying social and behavioral science theories to behavior and behavior change. Like, how do you take the concept and then apply it to design of a program, to an intervention? Applying specific research and evaluation methods to these types of interventions. So you have to think very carefully about what is it that needs to be measured and how will you measure it in a reliable way in order to evaluate whether or not a program is succeeding in achieving its objectives. Our curriculum focuses a lot on that, essentially the ecology of programs, like from the starting point of an idea to planning it, to designing it, to implementing it, to evaluating it. And throughout that is this idea of community engagement. How do we work with communities, engage community members and community organizations as partners in this process? I'm not going to spend lots of time right now going through our curriculum, but just as a quick overview, all Masters of Public Health programs are required by the accrediting agencies and basically by good sense to meet a set of foundational competencies related to public health. These are things like public health and healthcare systems, issues of policy, developing leadership, thinking about interprofessional communications, communication skills, basic planning and management skills. And all of that are covered in the core curriculum that all Masters of Health program, all Masters of Public Health students take over the time of their MPH degree. Our program focuses on the particular issues, as I alluded to before: psychosocial theory, program development and community engagement, program evaluation. You also, in addition to taking those 3 courses, which are our core sequence, you're also expected to take at least 1 course in research methods, and we have a set of courses that are open. Many people take more than 1 course. You have to take at least 1 course in applied health communication, since that's a foundational skill for, regardless of whether you're going into community applications, whether you're going into government work, et cetera, as well as at least 1 course on the root causes of health inequities. And we have I think we are now at like 10 or 12 different courses at the current moment that fit in that domain of talking about and helping you learn about those different root causes of health inequities. If you want more information about the detailed curriculum, it's available online. We can also talk in the question and answer about the particular courses that are being offered, but I'm just going to do a quick overview for you now. But I think a key piece of our curriculum that's important to talk about is the idea that it's not just about book learning. It involves applying your skills. So rolled into our curriculum is an internship requirement done usually in the summer between your first and second years, as well as a requirement to develop applied practice experience products. These are things that you develop often in conjunction with your internship, but they don't have to be. They can be done in other contexts. These are products that are developed as part of a practice experiment, not a research experience, but a practice experience. Basically putting the skills that you have to work for a community organization or something that has direct practical application. There's also a requirement for an integrative learning experience in our program that's manifested in a culminating essay. as well as a variety of other options that you may have available to you, including participating in research with faculty members, doing administrative roles, and a variety of different co-curricular experiences and initiatives. And Kieran can speak even more than I can to those kinds of options. So I do want to highlight before sort of moving into what HVHE is and the faculty in terms of some of the unique features of our program. One of the biggest ones is the first thing that's listed here, which is flexibility. In our program, the core curriculum, both the MPH core curriculum and the HVHE core curriculum, is only going to require you to do about a little bit more than half of the total credits that are required for completing your degree. That means that you have a lot of flexibility, both to select courses within certain requirements. So which communications course or with which health equity course you'll be taking, but also to pursue multiple courses in areas that interest you within the department, across the campus. So not just, you can be taking health management and policy courses or epidemiology courses, but also courses from across the campus in other schools. So we have many students who are taking courses in social work, in public policy, in School of Natural Resources, et cetera. And it is precisely that flexibility that enables each student who goes through our program to really tailor the experience that they have to their particular interests and needs. Our faculty are all involved in both teaching and research. So all of the tenure track faculty teach in addition to doing research. Even our clinical faculty who are doing proportionately somewhat more teaching are involved in research. And in fact, you'll hear from one of them shortly. So it's that merger of both the instructional side and the research that we do that is one of the core identities, I think, of our department. I've already said this, the community engaged approach is a really big part of our identity. You'll hear this from faculty, you'll see this in our curriculum, as well as the goal of not just thinking about this as an academic exercise, but incorporating practical experience. So the next phase I'm going to talk about, just to give you an overview. I mean, there's no way we could cover all of the things that our faculty do in this short period of time we have together, but we've put together a few slides and introductory recordings from different faculty members talking about what they do and their research. And I'll walk you through a half dozen of these just to give a flavor for the kinds of projects that are going on within the department at this point. So the first one is the Love Her Collective, and you'll be hearing from Christy Gamrell.
Hi, my name is Christy Gamrell, and I'm a faculty member in the Department of Health Behavior and Health Education. I wanted to speak very briefly about the Love Her Collective. The Love Her Collective is a group of researchers and community activists who are working together to identify the needs of trans women of color in the Detroit metro area. The Love Her Collective is a partnership between the Trans Sisters of Color Project and the University of Michigan, and we began working together about 3 years ago, and we started with focus groups to identify community needs. Now we're doing a survey called the Transformative Survey, and we've been working on developing a program to help trans women of color heal from trauma. And we are very excited about this work, and we are more than happy to talk with you more. You can follow us on Facebook at the Love Her Collective to learn more and get involved.
So the next faculty member I want to introduce you to is Justin Heinze, who's going to talk a little bit about his work on school safety.
Welcome, everyone. I'm so excited to hear you're considering Michigan for your graduate studies. My name is Justin Heinze, and I'm an assistant professor in HBHE. I'm also the co-director for the National Center for School Safety. We're a federally funded training and technical assistance center. Well, what does that mean? What that means is I get to spend my time working with schools across the country to help them develop, implement, and test their school safety strategies. And that can range anywhere from mental health promotion to threat assessment teams to important questions like should we have anonymous reporting system and school resource officers within buildings. I love being an educational psychologist in an applied field like public health, and I hope you'll consider the many things that Michigan has to offer when making your decision. Go Blue.
I'll say one last thing before moving on. One of the things I most appreciate about Justin's work on school safety is he's very vocal about the fact that schools are doing lots of things in response to perceived threats, and there is very little evaluation work as to whether those things actually do anything beneficial. And so one of the goals of that center is to try to actually figure out what are approaches that are show benefits and what are things that are basically wastes of money and often maybe counterproductive. So next up, let me introduce you to Mary Janovic and her work with older adults. Oops, I seem to have gone backwards. There we go. Oh, that's right. We don't have a recording from Mary. So let me just describe what Mary's work is. Mary is a researcher. She's a research associate research scientist in the department. She has, I think now, a couple of different federally funded projects focusing on older adults and particularly thinking about chronic pain management and developing strategies to help older adults manage their pain, especially for those who are facing declines in function. Um, but don't take away from this the idea that we just have people who are researchers. So even our research track faculty often engage with students, either in terms of having people work with them on their research, advising them, and or connecting with them in the context of particular projects. So I have a graduate student right now who's connected with Mary and is going to be working with her moving forward. So the next faculty member I want to introduce you to is Professor Ken Resnikow, who and one of his big issues is motivational interviewing as a technique.
What makes me excited about teaching MI? Well, I think there's really two things. One, it really helps students get jobs. It's a very powerful skill to have on your resume, and it's really helped many students throughout the years be competitive in the job market. And two, it's a skill that you can use not only at work, but really can influence how you communicate across all avenues of your life. The techniques such as reflective listening and pulling on change talk are not intuitive. They're not things that people generally can just figure out themselves. They require training and they require feedback, and this course provides that. So if you're interested in learning MI, consider our course. Runs in the winter every year.
Just to comment on Ken's work in terms of motivational interviewing, this technique is developed originally as in a one-on-one counseling context, but I've had the pleasure of working on several projects with Ken in which these motivational interviewing principles are being embedded into, for example, online decision support tools for patients undergoing breast cancer treatment, try to help them figure out, based upon their own preferences, their own values, what it is that they want to do and to help them manage the emotions of that situation. And so Ken and I have collaborated on a few different projects like that. So it's not just an individual thing, but it can also be part of a larger intervention project. Now I want to introduce you to William Lopez, who is one of our clinical professors, teaches a variety of different courses, and his research on the health impacts of immigration raids.
Hello, everyone. My name is Dr. William Lopez. I'm a clinical assistant professor here at HBHE, the University of Michigan School of Public Health. My work focuses on the health impacts of immigration raids, looking at both home raids and work raids. The book you see here, Separated, chronicles the lives of 3 Latina undocumented mothers after the providers in their lives were taken away during an immigration raid that occurred just a few miles from the University of Michigan. Why do I do this work? I do this work because I can bring my full self and all the tools that I've learned in public health to care for my family and for my community. I do this work because I have a deep-seated belief in health equity and because I want to write for, with, and on behalf of my community for the rest of my career. Welcome to the School of Public Health, and I look forward to speaking with you in the future.
And then the last faculty member I want to introduce you to is Roshanak Medipana and her work on housing solutions.
Hello, my name is Roshanak Medipana, and I'm an associate professor in HBHE. I'm also the director of the newly established Housing Solutions for Health Equity initiative. We are an initiative that aims to advance housing research and policy in Michigan. We aim to inform local, state, and national policy through interdisciplinary research on housing as it relates to equity in health, race, socioeconomic status, gender, and aging. Our work is rooted in a perspective that housing solutions need to consider health equity, and we are one of the only housing research centers in the country that focuses on public health and health equity. Housing is a multidimensional determinant of health, and it impacts the well-being of not just individuals, but also neighborhoods and cities. I look forward to meeting you all next year, and hopefully you'd be more interested in this initiative and reach out. Hello, my name is Roshanak Medipana, and I'm an associate professor.
Sorry about that. All right, so now let me turn it over to Kieran, who's going to talk a little bit about alumni careers and the different kinds of work pathways that our alumni take once they come out of our program. And Kieran, you can just tell me when I need to advance the slides. Oops.
Thank you. Perfect. Yes, thank you so much, Brian. So as mentioned earlier, I'm the director of the Office of Foundational Learning and Practice in the department. And so I work really closely with Jackie, promoting a positive student experience in the program, facilitating students' progress through the degree requirements, in particular, the experiential learning or practice requirements, internship and applied practice, as well as the integrative learning experience. I also work with alumni. And so this sort of piece of the presentation here is where we start to shift between those things you're doing in the program and then what you're going to do upon graduation. And we have a really wonderful alumni network who are very engaged, and we have a couple of videos or recordings to share from them as well shortly. Before we get started on that, just to kind of give you a sense of the breadth of experience that our alumni have. The skills that you're gaining in the classroom, the hands-on experience that you will do serving communities in addressing real-world problems in public health will lead you into careers. Some examples on this slide with job titles ranging from specialist, manager, analyst, consultant. Students, these are job titles of students who are responding sort of about 6 months to a year after graduation. We have, as I mentioned, a large and very engaged alumni network. So students and alumni connect through a mentorship program that we have in the department. Our alumni also lend their talent in things like guest lectures, coming into your courses and presenting on their experience. And also contributing funding to things like internship funding and scholarship donations. So you could be part of this amazing alumni network if you choose to join HBHE. It's about 17,000 alumni in the School of Public Health that you could kind of have access to for this support as you launch your career post-MPH. There are data on the website that we'll share in the chat shortly that have a little bit more organization sector statistics going back a couple of years for our graduates. And so, just to let you know that this is a launching off point, I'm happy to chat more about your interests and potential career pathways there after the presentation as well, over email or in a meeting. So as I mentioned, we will share, I guess next slide, Brian, we'll share these couple of snapshots just to give you that alumni voice and language to where this degree took them in those first couple of years after graduation. And so the first one we have here is Swad, and you can go ahead and play hers.
Hi everyone, my name is Saad and I graduated with my MPH in Health Behavior and Health Education in the year 2020. Yes, the year of the pandemic. My undergraduate degree was in healthcare management, so I honestly wasn't sure what route I wanted to take afterwards. However, when I got the chance to hear from professors and take a look at the required courses the HBHE department is what I connected with the most and what I imagined my career would look like. In the positions I've held, I can probably say I've used nearly every single skill I learned from this program. Currently, I'm the International Public Health Specialist at an NGO headquartered here in Plymouth called Mercy USA. I work on ensuring our programs are effective in delivering health, nutrition, and water and sanitation hygiene services to people affected by conflict and disaster in some countries in the Middle East and East Africa. Although my day-to-day work varies, studying roots of health inequities, social determinants of health, and psychosocial drivers of behavior change really allows me to better understand the communities I'm working for and to adjust my approach accordingly. So for example, although we might have a similar project in, let's say, Kenya and Syria, the cultures are very different. And so that means that has to be reflected in the actual project. I really loved the variety of classes, both in size and subject. The smaller classes are where we got to have incredibly interesting conversations. And the professors worked really hard to make sure that we got practical experience in the class. So when you're learning about grant writing, you're really writing a grant in collaboration with the local organization. When you're studying qualitative research, you're conducting focus group discussions in Grenada with a public health action support team. When you're taking global health, you're paying attention to this new virus that's taken the lives of a handful of people in Wuhan in early January. And one of my favorite parts of the program is that it really allows you the space to add those experiences and even take classes from another school. So I took social work, policy, and even a pharmacy class just to explore those interests. So honestly, if you have any topic that you're really interested in or a social justice issue that you're passionate about, don't be afraid to bring it forward, and I guarantee someone's going to listen.
Great, thank you. And then we also have a spotlight to share from Shayla.
Hi everyone, my name is Shayla Wilson. I chose HBHE because I wanted to understand how to help people make healthier decisions and what goes into the behavior change process, ultimately helping people everywhere live healthier, more fulfilling lives. I'm currently the Director of Digital Strategy at Evoke Kind, which is a healthcare communications agency that works with clients across different sectors. So I've been able to provide healthcare communications for big pharma, nonprofit agencies, NGOs, and biotech companies. Since graduating from the HBHE program in 2015, I've worked in a few different roles. Immediately after grad school, I worked as a research scientist with the Department of Veteran Affairs, primarily conducting diabetes research in Detroit. I left that role after 2 years to pursue a health communications fellowship within the Division of Diabetes Translation at the Centers for Disease Control and Prevention in Atlanta. And then from there, I took a digital manager role at Evoke Kind, currently based in New York, and I've been here ever since. I learned many things during my time at Michigan in the HBHE program, but most applicable to my career has been how to develop health communications that resonate with different populations. I've worked tirelessly to make healthcare more equitable and accessible, and I would not be able to make these things happen without the knowledge that I gained from my graduate courses within this program. I'm grateful for the experiences that I've had there and the network that I've built because of it. I will forever go blue.
Yes, and so we're just really appreciative of these couple of, we
Hi,
just had the
everyone.
two.
My name is Saad.
Oh, okay.
Yeah, sorry. There are LinkedIn contact information on these two slides, so you'll see that in the recording. LinkedIn's also a great way just to kind of explore other folks in the alumni network and career, job titles, locations. I'm also, like I said, happy to chat more beyond these two examples here. And we're just, want to thank those alum for those recordings. So I'll pass it back over to you, Brian, to talk about the application process.
Yeah, thank you very much, Karen. So we'll just spend a few minutes setting up discussion about the application process, but leave more time for Q&A as, to answer whatever you're concerned about or thinking about as you're applying. some quick thoughts from me as a representative of our admissions committee about what we're looking for. First of all, I do encourage you, if you are interested, to apply by our priority deadline, which is December 1st. That ensures that you will be considered for all scholarships sort of in the primary process. We sometimes have scholarship funds available for later applicants, but I can't guarantee that. But as long as you apply by December 1st, you will be part of the main consideration process. The thing I want to highlight in terms of the application is that talk to us about why you're coming to us. Like, what is your purpose? Why are you coming to public health? And what is the fit that you see for HBHE to those interests? We have people coming from wildly different backgrounds with many, many different interests. But we really want to see and hear how your journey through life, through your prior academics, through prior work, through health issues, whatever, is bringing you to public health and bringing you to HBHE. As you're writing your application, acknowledge your strengths and acknowledge your weaknesses. We understand that there are many different pathways here. Not everyone has had life being easy and perfect and everything going smoothly through undergraduate. That's fine. Talk to us. Share what happened. Share how you've grown from things, if there were challenges along the way. And we're happy to incorporate that in our holistic review of applications. One major note here, and I mentioned this is a holistic review, we do not accept GRE test scores. This is not optional. We don't take them. What we do is look at your whole application with that holistic eye, including looking at to what degree that you have had quantitative preparation. Now, that might be in courses that you took previously. That might be in your work experience. And either of those is quite fine if it shows that you have some degree of quantitative skill preparation. If your quantitative preparation seems relatively weak, missing, or out of date, our one recommendation is that you consider taking a college algebra course, and this can be through a community college or something like an online program, but it needs to be from an accredited program as a way of demonstrating sort of a foundational level of quantitative skills. The HBHE program is not a quantitative heavy program, but everyone has to take a biostatistics course as a part of the core curriculum for a Master's of Public Health program. And it's been our experience that it's really helpful if applicants have at least that basic level of quantitative preparation heading into their graduate study. And with that, I'm just going to pause. I'm going to leave this slide up for like 30 seconds to a minute just to flag our emails in case you want to jot them down. And then I'm going to pull the slide down so that we can actually look at each other and leave the door open for any kinds of questions that you may have. And while we're doing that, Jackie and Kieran and Cheyenne, is there anything that's come up thus far in the chat that we need to go back to and that I can speak to at this point?
I don't think so yet. They just asked about the presentation, and so I want to make sure everybody saw that this is recorded and we will be sharing it later. And I think it probably will happen after every department's discovery series is complete, all the virtual sessions. So it may take a week or so before you get the recording, and it might come to you by email, and they may also share it on the website.
So I see a question here from Jalen. Is an introductory college statistics course sufficient for the quantitative preparation? Yes, in general. I mean, so something like a standard intro statistics course, something where you've been having to do basic data management skills, et cetera, is certainly something that we'll look at as being a common source of preparation. This is not, again, this program is not very quantitative heavy. We're not expecting anybody here to be likely doing lots of formulaic math work. On the other hand, a good familiarity with the basics of statistics is always a good thing for analysis purposes, for being able to understand as a critical consumer of the different types of health data that we all interact with. I see a comment here from Anne about specifying faculty whose research interest is in health behavior change and social determinants of health. Honestly, my first reaction is I'm struggling to figure out any faculty whose interest is not at least somewhat in social determinants of health or health behavior change. Maybe me. I do more from a less a behavior change and more from a medical decision-making perspective. And those are obviously two sides of the same coin. Sometimes we're trying to be persuasive and motivating particular behaviors, but I do a lot of work in contexts in which only the individual involved can know what is the right choice for them, but we still need to inform them of their options, help them understand the risks or the benefits that they might face by engaging in particular behaviors. Think about issues of, say, if a woman is diagnosed with early stage breast cancer, there are many treatment options available to them and many things they can do to prevent recurrence. I can't make that call, and honestly, their clinician can't make that call, but the patient needs to know what it is that they're facing to make a good decision. Annika says, how does applying for scholarships work? And are there opportunities for teaching assistantships? So the first answer is everyone who we accept is automatically considered for the departmental scholarships that are available. And so it's part and parcel of the application process. You don't need to do anything different in order to get consideration. In terms of teaching assistantships, let's put it this way. While there are, in the University of Michigan, they're called graduate student instructor positions, many of those are taken by our doctoral students. There are some that are done by master's students, and that's done more on a case-by-case basis. And I should say this, there are opportunities not just within our department, but within the school overall, and oftentimes outside of the school. So HBHE, I know several master's students who became graduate student instructors in other programs on campus because their past background enabled them to play that role. But that's a process of finding the appropriate programs that align with your particular background and then applying to them there. Research assistant positions, however, are all over the place in different kinds. So there are fewer ones that are sort of like full, what we might call a graduate student research assistant that includes tuition coverage. Those are rarer. There are a lot of students who work for faculty on a part-time basis on sponsored research projects. And the short answer is reach out to faculty who look interesting. Like the context here is not that there's a central, this is the place you go. And much more the culture within the University of Michigan and certainly within HVHE is if you see an interesting, like if you were interested in the school safety stuff that Justin Heinze was talking about, grab his email him and say, hey, I'm really interested in this. And that's the way these things happen.
Brian, I just want to make sure that everybody heard, saw my comment after you were talking about tuition scholarships. We do not use the FAFSA to make decisions about tuition scholarships, but we definitely encourage you to fill it out and submit it. I'm not sure of the deadline, but I do know that they start packaging incoming students around March and April. So definitely get it in before then.
And as I saw you noted in the chat, that's relevant for the question of work study and work. We absolutely do have students, for example, working on research projects with faculty as work study. I'm just skimming here. I see one from Mai Chen. What sorts of background are helpful? Are there major specific areas that provide a better background? I'm going to basically say, whatever background brings you to us. Like there is no single path. People with social science backgrounds, we've seen people with arts backgrounds. I remember a student who came in with a filmmaking background. people with policy backgrounds, quantitative backgrounds, hard science backgrounds, biology. We've seen it all. The right question is not what's your background, it's what's bringing you to us. Like how do you see your background as leading you to a career in, that fits with HBHE? Tell us that story and we will be interested.
Brian, can you answer Valerie Kim's message about the GRE and using it in the quantitative statement?
So the formal policy, as I understand it, is that we are trying not to be exposed to GRE information. It is not an optional thing. We do not have people, and so as an admissions person, I would actually prefer you not to put that into, to try and fit it into an essay as a way of giving us that scores. What I actually care about is your background. Like, what courses did you take? What have you done in your work? I mean, I see lots of essays in the quantitative experiences statement that are about, look, I've been working here and I did this work with data sets and I was doing these types of tests and data cleaning. Like, that stuff is also relevant. We're really trying to look at this not through the lens of a standardized test, in part because we know the biases that exist in those tests and the ways in which they are not a perfect measure of what we really do care about, which is your ability to think and reason logically, to work with data, to engage in various quantitative tasks.
I think that there's a hand raised that's been up for a little while.
Yeah. Where was that, Claire? Did you have my hand up before?
Oh, I had my hand up before, but I see Adaremi. I'm sorry if I mispronounced your name's hand up.
Yes, you got it right, Adaremi. Yes.
So what is your, please go ahead.
Yeah, my question basically is, I've already submitted my application. I missed the deadline for last year. So this year I just put it on my calendar. The moment admission was open, I completed my application and I submitted, because I just didn't want to mess around with it again for another year. However, just one of my professors have submitted my recommendation. That's the only thing left for me. So will that affect me in any way before the December 1 deadline? I did my undergraduate and a bit of my postgraduate program in Nigeria, and then I did my master's in London. My professor from University of London has put in my recommendation, but my professors from Nigeria, because we have issues with strike, lecturer striking and all that, so I've not been able to get hold on them to be able to send in a recommendation for me. So that's my fear now, that will that affect you looking at my application? Would that have any impact on me?
Yeah, so the short answer here is get the application in. We will be obviously desiring to get all of the letters in so that we can do the full review. If you're running into a situation like the one you're describing, in which there is a specific barrier that is inhibiting you getting those recommendations, my first and strongest request of you is tell Jackie. Let us know what's going on. That then allows us to know, for example, that we shouldn't wait for that last letter, that maybe we do a preliminary review to help ensure that you're considered along with everybody else. So we're willing to, I mean, obviously we want everything in by December 1st if it's possible to do so, because that makes our life a lot easier. But if there's something like what you described, reach out to us and then we'll do our best to accommodate.
Okay. I will send an email to Jackie. And I will still continue pressing on my professors from Nigeria. And I will still, but would the fact that I have one in already, will it count for anything for me?
It's not that this will make it count or not count. We'll look at everything that we have, and the sooner you get the rest of the letters in, the better. But if we know that there's an issue, then we'll manage the review process so that it doesn't, so that you're not made worse off by the fact that something's coming a little bit later.
Okay. Thank you.
You're welcome. So now, Claire, I do see you have your hand up.
Can I just real quick clarify something here?
Yeah.
I noticed there's a lot of PhD application questions, and we will have a session on the evening of November 2nd. And there is a registration link that I put in at the beginning of the chat. There was somebody else that asked about it. I'll try to find it again, that you can go ahead and register, and we'll go over some application information, and then I will be there to answer additional questions about the PhD, HPHE PhD application process.
Thank you, Jackie. Claire, you have a question?
Yeah, I put it in the chat, but I didn't see it addressed. And so my question was, have you had HBHE MPH students participate in the Wisconsin LEND, that's the Leadership in Neurodevelopmental Disabilities training program? And so it says that public health is one, sorry, this is my
No
daughter. Gretchen, can you say hi? Hi. Hi. Yes, she has developmental disabilities, which is why I'm interested in public health and family support and health education, health promotion.
Yep.
So my question was, have you had HPHE people, MPH students participate in the LEND program?
I am not remembering anybody, but I am not, I won't claim to be the institutional memory of everything that's gone on here. Jackie, do you have any memory of students who haven't participated in that?
I can't think of anybody, but maybe send an email to me and I will think about this a little more. Yeah. Just in case.
And I will say we do have students in other like fellowships, or we've had students in other programs that had overlapping requirements that we worked with the student to sort of integrate what they're doing for things like internship and applied practice with the goals of the fellowship, for example. So we're very flexible in that regard if there are requirements for the program like that. We've definitely worked with many students around, not on this specific topic, but I think we would have some thing to go off of to support a program like that.
Other questions about the application process, what we're looking for from applicants, or just things about the curriculum that we could answer before we move into our breakout rooms?
I can't remember if there was another question about scholarship decisions. Did somebody ask about when we make those decisions, or did you go over that, Brian?
I didn't go over that, but it's a good thing to go over. So let me do it, even if somebody didn't post about it. So as I mentioned, you don't have to do anything different in order to be considered for scholarships. We will be reviewing every admitted student for the departmental scholarships as long as your application is in by that December 1st deadline. We will usually be making scholarship decisions sometime around, I hope, knock on wood, I hope around mid to late February, so that you have ample time to know what scholarship offers we will be giving. They are made separately from the admissions decision. So you will first get an admissions decision, and then we go through the process of looking at the whole cohort that we are admitting in deciding our scholarship offers. If something comes up and you need to know status, please, again, reach out to Jackie, let her know that you may have need for information, and we'll do our best to let you know the status of where things stand for your application and in terms of scholarship. And we are very aware that this is a major decision that you're facing, both from an academic standpoint and a career standpoint, but also from a financial standpoint. So to the extent that you can help us understand your situation, that's often very valuable to us as we're trying to think about how we move forward with each applicant that we see.
Brian, do you see a couple hands raised there?
I am not seeing the hands, so can you call on people?
Is it Isa?
Hi, yes, it's Isa, thank you. I have two questions for you guys, and let me know if this is something I should ask separately or follow up on. But the first question I wanted to ask is that when I was looking at so I'm looking into the MPH program, and one thing I was looking for was kind of a place to kind of just talk on like certain difficulties that I experienced, and I was wondering what the best place to do this was. I saw that there's maybe like a 600 character spot for that, but I just felt like it wasn't enough to kind of talk about certain things. So I was just wondering, do you perhaps you guys would recommend a place to, write this, or maybe have a better idea, or if that's the only place and that's the only character I can put it in?
So, I mean, my short answer is there is this sort of personal experiences statement that is a catch-all for all kinds of things that you can put in, as well as the primary essay. Depending upon what it is that you want to share with the admissions committee, you can use either of those as you see fit. Certainly, many applicants' main essays incorporate information about who they are and how they got interested in this, and what their journey has been. And if that's appropriate to bring it in there, please do so. If there's something that you're going to really struggle to describe in sufficient detail, I guess my advice is allude to it in the space you have, and then we may follow up with you if we need more details.
Gotcha, thank you. And
I think there's
second,
another little spot that you could probably add some information, like it just kind of says generically, like, is there any other information that you think we should know? So I think there is a spot like that on the
yeah, that was the 600 character spot that I found, and so I think that was really helpful to kind of gauge the two other areas I could do this. So thank you. The second question I wanted to ask was, I saw that there's like a dual MHSA and HBHE program, and so if that was something that I'm interested in, is that something that would be discussed in the breakout rooms, or is that something additionally that I would follow up separately for?
I think, let me say something generally, and then the short answer is follow up separately, because depending upon what type of dual degree program you want to do, we can give you more information. But I should say more generally, one of the best things about the flexibility of the HBHE MPH program is that it does make it possible for people to do dual degrees with a variety of different programs. So we have social work dual degrees, genetic counseling dual degrees. You can essentially build your own dual degree if you get admitted to another master's program on campus. And there's a particular structure for how you meet the requirements, but you still end up having some degree of elective space and flexibility even when doing a dual degree. So if you're interested in dual degrees, please do reach out to Jackie and potentially to me, and we can answer any questions you may have.
Okay. I thought there was another person with their hand up, but there's Anne has her hand up, and that will probably be the last one before we.
Yeah, I think that's right, since I'm seeing many of my faculty colleagues joining us. Thanks, everybody. So please, what was it, Anne? Please share what your question. Yeah.
Okay, thank you. Thank you, everyone. I kind of joined late because this is past midnight in Nigeria. My name is Anne. So I wanted to find out for the application, can I apply using my unofficial transcript? Just like Aderemi said, the strike, there's been this ongoing strike in the last 8 months, and it's just been called off. So getting official transcript is it's a tough one.
Yeah.
So I wanted to find out if I could, pending when all of that is resolved back home here. So I wanted to find out if I could apply using my unofficial transcript.
So that is
it a PhD or MPH?
PhD.
So for PhD, you definitely can upload with your application an unofficial transcript. If you are accepted for admission, then you will be required to submit the official copy before you can matriculate into the program.
Oh, beautiful. Thank you.
All right. Thanks, Jackie, for answering that one. Let me pause us here. Obviously, if you have more questions, please reach out to Jackie or myself. We're happy to answer any questions you may have, but I want to take time now and move us on to the next part of our session tonight, which is the faculty breakouts. So what we are going to do is to set up a faculty 4 breakout rooms on the topics that you see here. Jackie, are you setting them up, or do I need to do that?
Yeah, I'm sorry, I'm in the middle of some chats.
Okay. So I will work on setting these up. But the 4 topics that we want to do today are community-based research and social justice, mental health, and global health. And I think I saw all the faculty involved here. So let me just rename the rooms. And then as soon as I get this set up, we will let you move into the rooms on your own. There is no agenda here. This is not, we're going to give you a speech or anything. Each room will have 1 or 2 faculty who are interested in these topics, but the main goal here is to allow you to talk with them, to share your interests, and to learn more about what might be going on in that area, just to share and experience, get to know some of the HPHE faculty more closely. So I think I've got this all set up. So I'm going to open all of the rooms. You are welcome to join them. And I will hang out here with Jackie and Kieran in the main room. If you want to talk to me about health communications, you're welcome to do so. Or if you want to ask more application related stuff, you're welcome to do so. Otherwise, please go ahead and select which room you want to move into. And hopefully you'll have a good conversation.